One of the most important parts of any type of epilepsy workup is obviously the electroencephalogram, which is an EEG. And this is something that most people with epilepsy have had at one point in their life. One of the things that we have at Weill Cornell which differentiates us is something called the NeuroPICU, which is an actual ICU room which is specifically designed for the monitoring of patients with epilepsy. We have cameras and the EEG electrodes hardwired into the room so that not only can the patients stay here in comfort with their families, but that physicians can monitor them 24 hours a day, whether they're in the hospital or at home, and really get the most accurate and up-to-date information on their patients. We also have the most high-tech available radiology equipment possible, whether it's PET scan, high magnet strength MRI scans, diffusion tensor imaging to look at fiber tracts. All of these imaging modalities are part of our workup and our diagnostic rationale for doing surgery in patients with epilepsy. Now, we have a really unique collaboration here at Weill Cornell. I'm a pediatric neurosurgeon. I work with an adult epilepsy surgeon on the neurosurgery side, and we have an entire collaborative team of epilepsy doctors, starting with Dr. Paulicki, a neuropsychologist, and an entire team of 15 or 20 people that meet every time one of our cases seems possibly appropriate for surgery. So anytime that a patient goes to surgery, we know that it's been thoroughly vetted by an entire team and that all non-surgical options have been explored before proceeding to the operating room. The idea of surgery for epilepsy is not as widespread as one might think, despite its really high efficacious rate at curing seizures. I think it can be clearly said, although it's a bold statement, that surgery is really the only cure that exists for epilepsy. Epilepsy doctors are really good at controlling seizures with medications and other palliative techniques, but to actually cure a patient of epilepsy requires surgery. Not every patient is a candidate for surgery, but for those who we deem as a collaborative group to be a good candidate for surgery, we can literally change their life by making them seizure-free. We're talking about the ability to drive, to go to school, to swim, to do activities independently. But more important than those things, which are obviously very important, is the ability to wean off of medication to prevent the deleterious effects of being on medication for the entire life, which has severe cognitive and developmental effects in the developing brain. So when we talk to a family about doing an implant surgery, we're really talking to them about doing at least 2, if not 3 surgeries in consecutive sequence. They may be separated by a day or 2 or as much as a couple of weeks, but the idea is the following. First, we implant a grid to get as much information as we can about the exact location of that seizure. We then map the patient to make sure that that seizure does not overlap with any areas of the brain which are crucial for functioning, such as motor function or speech function. If we know that we have 2 non-overlapping areas, or if some type of a deficit is acceptable to cure a patient of epilepsy, which is sometimes the case, especially in young children, then we'll proceed to resective surgery, at which point we'll actually take out the grid and remove the area of the brain that we've mapped out as a team as the area that's most likely responsible for the seizures. I think the tools that we have at our disposal right now are extremely beneficial for most patients. I think the largest roadblock that we face is actually education of neurologists in the community who may not know that their patients are actually good candidates for epilepsy surgery. Certainly there are a number of high-tech things that are on the horizon in terms of deep brain stimulation or possible further implants into the brain. But right now, the fact that we can actually cure epilepsy in the proper population of patients here at Weill Cornell is a very exciting thing for us. And if we can do as much as we can to get that message out, I think we'll have done our part.